I think this is my last topic for today. The next topic and the last topic for my presentation is the data management and contact tracing. Not everyone is cut out of reporting, but at the end of the day, this is an accounting of what we have done or the team has done. So the DOH will not be able to update the daily reporting as well as the analysis of report without the reports coming from us or from you, and also the surveillance officer. So these are the guidelines, or there are the guidelines and issuances that the DOH releases as a guide of every stakeholders. First is the DOH issued the Department Circular 2020-02101. So this is the mandating the utilization of the EB COVID Kaya information system for a close contact data and reporting of contact tracing data. COVID Kaya endeavors to support the global community and provide community-centric IT tools to help proactive response and decision-making by authorities. We're also extending peer-to-peer support through local communities. If you notice, every 15 days, the IATF at the national levels and they announce what kind of quarantine status will be implemented in different places. The decisions are based on the information recorded in the COVID Kaya and interpreted by the analytics team. In the minimum requirement generated, or the minimum data that will be generated by the COVID Kaya information system, are the case information of the suspect, probable, confirmed, close contact information, laboratory specimen monitoring, or the tracking report. You can access the COVID Kaya with this link down, but be sure that you have an access on that. So this one is the face of the COVID Kaya, or our COVID Kaya, the official system that use of COVID-19 data. In the DOH, there is no official information system that is not anchored in the law. And this law have administrative orders, department circulars, or memo to support this. In DOH, Circular 2020-0197 mandating the use of COVID Kaya, that all health facilities, community quarantine units, and temporary treatment and monitoring facilities, or your TPMF, catering the suspect, the probable, and the confirmed case patient must report these cases. So what are the reporting forms to be used? So Form A is your case investigation form, Form B, your travel history and event, and your Form C, the close contact line list. Using the form, they encode it in a COVID Kaya information system. And then the information system will have the database of all encoded information from those forms. From Form A, the case investigation form, or the COVID-19 case investigation form, as I discussed it earlier, that this form will be used once we identify the suspect or the probable case. This Form B, or the travel history and event form, is the form used to collect information related on his or her travel and events. This assessment will be done by our contact tracer. Once we have identified a close contact, we will use this form. The Form C, or the close contact line list form, in this form, you can see the nature of contact. What kind of contact can be seen on the third column starting from the right? So these are your household, HH stands for household, your WS stands for workstation, S for sea vessels, T for travel, A for accommodation, whether hotel, bed, then bed and accommodation, bed and breakfast. For example, HCW is for healthcare workers, and O is for others that are not mentioned above in the Form C. So next is the contact tracing confidentiality in ethics. So this is all our protection, not only by us, but also by you as a contact tracer. Public health practitioners often have the legal requirements to act to contain a communicable disease within the broader population, and also cite an ethical duty to warn individuals of their exposure. Simultaneously, Infected individuals have a recognized right to medical confidentiality. We should not post in any social media of what we know to that person that was infected by the COVID-19. Public health terms typically disclose the minimum amount of information required to achieve the objective of contact tracing. How can we ensure that the forms we saw earlier, especially the form B and C, we should remember? Example, only the contacts are told and that they have been exposed to a particular infection but not informed of the person who was the source of the exposure. Next is the confidentiality and the risk of the stigma. If a social mobilization or advocacy campaign of our healthcare workers are not good, it will affect the confidentiality of the COVID-19 patient. Fear of loss of confidentiality and subsequent stigma, discrimination, or abuse as a result of contact tracing that may discourage person from seeking medical treatment. Please note again, to understand the public health official have recognized that the goal of a contact tracing must be balanced with the maintenance of trust with vulnerable and sensitivity to those individual situation. That is what we always remember as a contact tracer. So Data Privacy Act of 2012, DPAR Data Privacy Act, is not a hindrance to a COVID-19 response. It allows for contact tracing, testing the patient or treating the patient, and addressing threats. It guarantees privacy of the COVID-19 positive patient, suspect cases, and a close contact. The Public Act number 11332, or an act of providing policy and prescribing procedures on the surveillance and response to notifiable diseases, epidemics, and health events of the public health concern, mandates cases and close contacts to be fully transparent and truthful to the health authorities on their personal data. Sample is their travel and the medical history, etc. Requested from them to contain the spread of the infection disease in a timely manner. Not all data is required, but only those periods that we discussed earlier, from 2 days prior to the onset or the collection of the specimen after the day of quarantine, or 14 days forward, depending on what presentation of the patient either. It's either asymptomatic or moderate to severe cases of COVID-19. That's all we need to prepare. So I think that's the end of my presentation. If you have any question, I am willing to answer to the best of my ability. Thank you very much.